Because we need veins, arteries, and nerves. You got me? That's very important. And then we start making this bone. But then again, intramembranous bone versus endochondral bone. Two different forms of making bone. One is bone cells migrating into what is already collagen, what is already formed connective tissue called cartilage, and then we're just going to take it over. Versus, we're just going to migrate, excuse me while I sandwich in between the two of you. All right, I'm going to sandwich in between the two of them, and then I'm going to start laying down bone. So one center of ossification for this bone, one center of ossification for this bone, one center of ossification for this bone and this bone. But then sure enough, what? Our faces develop left and right separately and then squeeze down the middle and meet us in the midline. When you have a child who's born with the lip open, what do we call that?
Cleft.
A cleft lip. That's inability of the face to fuse midline. The skin fuses after the bone. So if the bone doesn't fuse, does the skin fuse?
Nope.
No. So a cleft palate is always going to be with a cleft lip. Got me, guys? It's in the book. Cleft lip, cleft palate are synonymous. If the kid's got a cleft palate, his lip's going to be cleft as well. They can't verbalize. They can't verbalize. Their sound is not bouncing off the roof of their mouth. It's going up into the nasal cavity. So they have a nasal pitch to their voice. Does that make sense?
Yeah.
Of course, you guys don't want to teach it another way. I'm just not. So you need the maxilla to fuse midline to create the hard palate, but you also need two little bones called the palatine bones. I've already mentioned all the bones of the skull, by the way, right? Ethmoid, sphenoid, temporal, frontal, parietals. They make up the roof of the skull. Ethmoid, very important ethmoid because it's associated with cranial nerve number 1. Right? The olfactory nerves. These are nerves that are sitting within the bone. Bone is actually protecting it. And you have multiples of them, and they're up in the upper part of your nasal cavity. And the ethmoid comes down and splits the nasal cavity into left and right nasal cavities. So you have two different cavities. Anybody ever have a deviated septum? Get punched in the face too much or run into walls too much? Does that naturally happen? Sometimes it gets there, right? Yeah. Some people who sniff too much cocaine get perforated septum. Why? Because the cocaine causes constriction of blood vessels, which deprives the bone. Deprive the bone dies. They'll blow chunks out their nose and be able to put a bull ring on like this. All right? So you see how things are so clinically relevant? Yeah? Somebody who has, so you asked me about the vitamin deficiencies, because remember, so we got to make proper collagen, but the role to make proper collagen is based upon this cell's ability to make this small little cute proteins called tropocollagen inside, and then to secrete them outside. And then once they're outside, they get polymerized. They go into this, this process of becoming like, I always use the analogy of sort of like the Transformers. When you hear that sound of the Transformer, you're going to go from car form to robot form.
Yeah.
It's like that, all right? Tropocollagen, once it leaves, man, it transforms itself from being these small little units to being this huge unit called collagen. But to become collagen outside, for tropocollagen outside, to become collagen outside, you're going to need copper, and you're going to need vitamin C, along with the necessary enzymes that would catalyze this polymerization of tropocollagen to collagen. Okay? And this is why back in the day, when young men, 12, 13 years of age, were put onto boats as seamen recruits in the Navy, British Navy, Spanish Navy, whatever, if they were on the boat for long periods of time, because we're still in this process of growing, right? Remember we talked about this, right? They weren't getting enough vitamin C. And so if you have a deficiency, so here, if you have a decrease in vitamin C in your diet, when your bone is remodeling, remember we said this wall is never, it's not, you think it's fixed, but in reality it's dynamically changing. That means we're dynamically remodeling regularly, which means we need a consistent amount of vitamin C in our blood. If we don't have that, then it'll result in skeletal deformities that we refer to as scurvy. So you need that vitamin C. You need the copper. Copper, small amount, trace amounts. We have ways of recovering copper from diet. So in most cases, you don't see anybody who has a copper deficiency. Normally what you see is someone who has a copper overdose. Why would someone have a copper overdose? Something's wrong genetically, or
teeth maybe?
you're taking too much supplements.
He's
taking too much supplement.
I thought maybe they use, I don't know.
No, what happens is they just take too much of it. They're taking because they don't realize a supplement is a supplement. It's not something that you take, regularly 3 times a day when you're supposed to take it once a day and you only need a small amount of it. So when you usually it's a genetic disease where you're accumulating too much of it and storing it, and it produces, you look in the eye and you get this, there's a coloring to the eye, it's called a Kaiser-Fleischer ring, where it's literally like a coppering of the iris of the eye. It's like a brown ring on the outside of the eye, and that's called a Kaiser-Fleischer ring. That's indicative of increasing copper in the bloodstream. And the only way you can get that out is through what we call chelators, which would bind the ions to get them out. So usually you don't see people who have deficiencies in copper. You do see people who have deficiencies in vitamin C. Especially if they're young and on the high seas, like these pirates in Somalia. Right? You get these young kids who become pirates on the high seas, and they're never coming back into shore and eating vitamin C. They're gonna have problems. Right?
I thought you were gonna say that they used copper to replace teeth.
No,
back then.
no, they use actually gold. Yeah, they used gold for a while. It's silver, and it's silver amalgam as the technology got better. Yeah, which is like mercury with silver. Yeah. So then now they get into other stuff like pure prosthetics. Like they don't even do, like you can do fillings with amalgam, but there is mercury in it, and you will swallow that mercury. So at some point, because cavities only get bigger over time, so that means the filling falls out.
What's the best
over time
for fillings now?
They have an amalgam that has no mercury in it, but it is more expensive.
Right.
It's actually a resin, a 2-part resin. Yeah, it's like super strong resin.
What do you mean that the cavity only gets bigger?
The cavity is, I guess it's acid that weakens them. Yeah, so over time, the cavity is just going to, slowly and surely, it's going to work on the margins of where the teeth is exposed. So even if you have a decent filling in there, over time that filling is going to only be so big. And because the teeth are dynamic, and they're always being exposed, then that edge between the filling and the tooth will just get bigger, and your cavity will get bigger. So you would hope that the cavity filling would prevent that cavity from ever getting bigger, but in reality, it doesn't. Especially if you don't change your eating habits. You keep eating the sweets and not brushing your teeth. Guilty as charged. Right? I just like my sweets. You gotta brush your teeth after you eat your sweets. Because the bacteria, remember I had a young kid and I had to do PG, about 26 million kids. She was like in 3rd grade and SHIT came out once. So, yeah, you have to brush your teeth once you're done eating sweets. Otherwise, the acid, because we all have bacteria in our mouths, so we're all shit eaters. Right? That bacteria converts the glucose to an acid that will make the enamel of your teeth weak and will increase your risk for right, the cavities. So this is already something that's in our nature already built up in us. So we're meant to lose our teeth over time. It just is what it is. Periodontal ligament loosens after a while, teeth fall out as well. So it's just inevitable, right, that we will gum our food if we're lucky. Otherwise you die of a massive heart attack and then it never happens. Right? You never get to gum your food. Something to look forward to as you get older. All right. So guys, bone is so important. All right. So notice that I didn't say anything about HSC cells moving into intramembranous bone. Yeah. Bones of the skull and face. Yeah? Somebody left their phone here and called it. So here, the osteoblasts, guys, will insert themselves into here and start laying down bone between the connective tissues. That's why they call that intramembranous bone formation. The bone that they make, they call it woven bone, or spiculated bone, or diploic bone. Why diploic? Oh, because you get like this kind of, over time, you'll get like this inner table, outer table, but then it's just kind of like connected in between. It doesn't look anything like that. Everybody see that? And the bones of the skull and face aren't designed for force. Although I gotta be honest with you, right? Watch a decent boxing match in slow mo, and you can see the face, the bones of the face actually flex. So even though this is much thinner than this, I can tell you from personal experience. Thank God for my flexible head, because one time I slammed my head onto the ground, coming from 12 feet above or 14 feet above, and then landing straight on my head. Luckily, I didn't crack my skull because I had a Protec helmet, which are the helmets that they use for skydiving. They use them for snowboarding, and they use them for a lot of other stuff like parachuting.
Did you land straight on your head? How did you not mess up your neck?
Every once in a while you see me do this. So I get those kinks in that. I get that arthritic condition in the neck. I get super tension.
That nothing else happened.
I got lucky. That's it. That was one of a few occasions. So I got lucky. Even though this bone is thin that way, it's still quite strong and flexible, especially as we mature, right? So when we're born, we have these soft areas in our skull. And why do we have that? Why do we have those fontanelles?
I could be wrong, but I thought it's so that you can come out of your bone.
Yeah, so you can slide out the vagina, absolutely. Yeah, don't be embarrassed. You can slide out the vagina. You foot first or head first? Which way you want to go? You got to go head first. You go foot first, we got problems. I got to turn you around, or we got to do C-section on you. You get me? You got to come out one way or another, because mommy doesn't want you in there past 10 months. Yeah, it's 10 calendar months. It's 9 whole months. They didn't tell you that, did they? You think it's 9 months, and you realize, oh shit, I got another month. And the last month is the torturous one. Because when that baby spins around, you feel it. Because now the baby's big, 42, 44 inches, right? And their feet are pressing up. If they're in the right position and their head is down in your pelvis, that means they're pressing on your bladder. It means you're urinating constantly. The belly gets bigger. And you can see as the belly starts to sit further down, the pelvis starts to soften. Right? Because the baby's physiological responses from stealing calcium away has softened the pelvis so much so that it can now actually stretch because it's made up of collagen type 1. How amazing is that? And then separately, the head, because it's made of multiple ossification centers, still has these areas which are not fused. The bones are not fused. So the head can literally fit through the dilated cervix, which has to be 10 centimeters. Has to be 10 centimeters. The vagina is an incredible tube. Like, it can stretch quite large because it's made of smooth muscle. So you ain't got to worry about the vagina not stretching. What you got to worry about is at the far end, at the end of the orifice of the vagina, there's a lot of connective tissue there. And if it rips and tears straight down, can't have that. So what do doctors do? They'll take scissors and cut just to the end. Because in some cases, the baby's skull will be too big. Because the baby's just too big. Now, if it's too big and everything is coming out, they'll take them out through here. That's why you're already set up in an OR. In the OBGYN ward, there's an OR right down the hall. You get me? Because if it comes time, I realize, oh, that baby's head's way too big, it's not coming out. We're sending you right over to the operating room to do the C-section, emergency C-section. It's right down the hall. We got everything already prepped. We got 10 to 20 females pregnant and delivering regularly in that ward. And you got the ER just in case, right next to it. So that's how we work it. Now, the reason why we have those fontanelles is so that the plates of bones can shift without causing damage to the brain and allow us to slip out the vagina head first. You never want to touch those fontanelles because what they are, they're where epicranial aponeurosis touches dura mater, and right underneath it is brain. So don't ever touch the fontanelles. Never. Something falls on that baby could have massive brain damage. If the baby falls and injures that area of the fontanelle and bruises it, it could cause massive brain damage, yes.
And the older we get, the wider it.
No, so what happens is once you're born, it's quite amazing. Once you're born, then the bones realize, oh, you're born now. Took your first breath, everything else, and the bones start to suture. The bones start to suture. And as the bones start to suture, then they'll become fixed in place. But sure enough, guys, again, there's a human skeleton up there. You can see it. There's still play. But it's the most fixed suture that we know, and that's called a fibrous suture, guys. You get me? Those fibrous sutures are the strongest sutures that we can make. And the more you get that suturing, that kind of interwovenness between the bones, the stronger it is. So we have a plan for skull. It may be weak at first, but over time, yeah, nice and hard, like my mother always used to say.
Is it true for babies when the fontanelles are
Can be an indicator. In other cases, you see babies, and it's in there, hydrocephalus. That has nothing to do with the bones. Luckily, thank God that the bones are not fused, because what that has to do with is excess fluid that can't move. The brain produces fluid, right? So the fluid inside your brain and spinal cord, it's inside. But you put it in a bag and it leaks out. So the brain produces a fluid inside that leaks out and allows it to sit and float. That fluid accumulates, but only to a certain extent. And then we put it into the venous system. But these kids, they don't have that connection from the bag to the venous system. So the fluid builds up. And what it does, the fluid builds up. And what happens, the bones, they get further and further away from each other. So then they have what? They're less likely for those skull bones to fuse. Does that make sense? Yeah, because the bones are further away. So what do? You fix the defect. Get that fluid back into the venous system by putting a bypass in. From brain to the venous system. Fluid moves back in. Head shrinks back down. Now you're not Megamind. Anybody see Megamind? Come on, guys. Sorry, you're not Megamind anymore. Head goes back down to normal. While that happens, you see the kids, they're wearing helmets. Because if their bones don't fuse, then just like a little baby, if they hit something, they fall, they hurt, they can cause brain damage. So you got to put the helmet on. And then what happens is, as the fluid moves off, skull gets smaller, bones get closer, they fuse, you're okay, no problems. But the stent, they're always going to have that stent. And as they get bigger, they'll have to have a bigger stent put in. Because if not, then what happens? Once the bones fuse, that fluid accumulates, squeezes on the brain, pushes it right down through the foramen magnum. This is why, you remember the famous lady, the reporter, who was skiing, and she fell, and she hit her head. She's like, no, I'm good. I'm going to go back to my hotel. She went back to the hotel. What happened next day?
Died.
You found her dead. Because you got no room in here for nothing else once it fuses, guys. You hear me? Any fluid that builds up once these skull bones fuse,
Done for.
you're done for. That's why you suspect somebody who has a head injury. You take them straight to the ER. They do a CAT scan on them. They find out if there's blood. If there's blood, they tap it and extract it. If they have to, they'll drill holes. They'll do whatever they can, because if not, that person's brain's going to get herniated right through the skull.
Trepanation? Is that what it's called? Something like that?
Herniation. It's called brain herniation.
I mean when they drill a hole.
Oh, and it's trepanation. Yeah, trepanation. Yeah. When they tap the skull like that, yeah, it's trepanation. Yeah, it's ancient.
Okay.
They did this stuff back in Egyptian times. Trepanation is one of the oldest. That and frontal lobotomies.
And it's just cutting the skull to the point of where you see the brain?
Where you see the brain and the coverings, and you'll see the fluid. If the fluid is on the outside of the brain, then you can tap it and the fluid will just leak out. And then you'll leave it there, and then when everything goes back to normal, then you'll put a little bone insert or a metal plate.
Okay.
Just so, because you don't want an easy pass. You know, let me get your brain. All right? No, you don't want easy pass. There's an easy pass here, right? It's got to be hard. All right? Yes, question.
I know that all head trauma is bad, but at what point is it going to be like an emergency room situation? When
anytime you suspect head trauma, it's an emergency room. Because what happens? You may not see. So watch this one. You don't see me. I didn't break any skull bones, right? But did my brain just bounce off the front of my skull and then bounce off the back of my skull?
Yes.
So could I get contusions?
Yeah.
They call this. So when I'm in one direction, they call that a coup injury, and then when it goes opposite, it's called a contra coup injury. So just from accelerating or decelerating and then rebounding acceleration, you can have damage to the brain, contusions to the brain. In that case, I can't do shit for you because that's fluid that builds up inside the brain mass. Yeah, we just have to wait and see how your immune system helps your body remove the blood, and guaranteed you're gonna have some kind of brain damage. You got me, guys? Because blood does not belong inside the brain, and it surely doesn't belong outside the brain as well, right? On the outside, once the skull is fixed. Once the skull is fixed, you don't want any accumulated fluid. You have fluid moving, but you don't want it accumulating anywhere. You got me? Yes.
Does it feel like a headache or something?
Yeah. Oh yeah. Yeah. Like she felt fine afterwards, but I'm sure she got the worst headache. They call it the worst headache of your life. That's an indicator. Be careful. People always say, "Man, this is like the worst headache of my life." That could be actually a blood vessel that's broken inside. Very little time to get in there. Because it may be a blood vessel that's leaking up and it'll leak on the outside of the brain, push the brain through. So you don't have a lot of time to get in there, fix it, before that excess accumulated fluid will squeeze the brain down in there. So you got to go in there, aid in the alleviating of that pressure of that fluid, and fix the defect. It's not easy. I had my aunt died of it. And she had a berry aneurysm and the blood vessel just, and the fluid just stuck right through. She was dead.
You say the worst headache of your life, but what if someone has migraines? Would it be literally worse than that? I know.
So migraine headaches, it depends. So most migraine headaches are due to some kind of vasodilation.